Today's coronavirus day 931, and we are reporting very closely to 900 plus dangerous cases, and of course Monday, new week, so we will see how results come out this Thursday. So overall numbers since the pandemic, of course, we haven't seen numbers being updated since way early June. So unfortunately, that was not one of the things that was actually covered. So that's just unfortunate. And fourth vaccine shots are available to those 18 plus. So especially with wave 7 of coronavirus, and since wave 8 of coronavirus is also upon us, it's also a good choice to, if you're planning to get your vaccine shot. So if you haven't got your second or third, this is highly recommended. And vaccines for Tots are also available now, but of course, as of late July, which we'll get to that. So, bivalent vaccines, that's only for 18 plus right now. For that was approved just a couple of weeks ago. So. You can still get registered for these at COVID-19 on OntarioHealth.ca or by phone at 1-833-943-3900 or at your local pharmacy or local health unit vaccine registration sites. And regarding vaccines for Tots, last year parents were asking local regional and also provincial governments and also health companies to make vaccines for Tots, because only as of December of just 2 years ago, vaccines were actually approved for also the age group 5 years of age and older. Yet they were worried that my kids are under 5 years of age, and how can I protect my children since they're not eligible to get vaccinated? So we had Pfizer Incorporated and BioNTech SC go back in the lab, and also Moderna Incorporated also went back to their lab, and they were making the Pfizer-BioNTech vaccines for Tots, which has not been released, but the Moderna vaccines for Tots has been released, which is half the average dosage for the rest of us, which are we are getting vaccinated with first through fourth vaccine shot, excluding the bivalent vaccines, which is a different situation. So we released the Moderna one, back in. So both did get approved by Health Canada, and especially people over specifically Alberta, they were begging for it a lot. Even asking Dr. Dina Henshaw, medical officer of health for Alberta, for it, and also vaccine makers for it, and also local, regional governments. So they got released in late July. They were out, yet parents chose not to get their young children to get vaccinated. And why is that? Because they asked for that last year, and they got it. They're out. Yet they refuse to get their little ones vaccinated. And it's all because they are listening to a whole bunch of bias and misinformation that is being spread by people who shared it on social media, saying vaccines are bad for you. You can get coronavirus from the vaccines, and also even some misleading physicians, although there's a tiny fraction of them, saying also saying that vaccines are bad for you, and coronavirus is nearing an endemic. You don't need to get your little ones vaccinated. They're useless. It's just like getting affected by the common cold. It's no big deal. But it is a big deal. Because wave 7 of coronavirus hit pretty hard. And not only did we get another variant, but Omicron was the only variant that also spread subvariants BA1 through BA5. So there's technically 6 of them, because BA1, BA1.1, BA2, BA3, BA4, BA5, and BA4 and BA5 being the worst ones. That's the one getting people hospitalized with coronavirus, and even some people who are dying after severe symptoms, which is not very common, but some people, they end up getting affected, usually mild, but not really that bad, which is a rare occurrence. And originally BA2 was the worst one out of the whole bunch, but BA4 and BA5 overtopped BA2, and BA5 is the worst one out there. And now we have reports of BA2.75, which is just as bad as BA5, which is affecting people over in India, also affecting people over in United Kingdom, and it's spreading all over Europe and Asia. And due to no travel restrictions, that also can affect people just about anywhere. So someone from affected countries, they might come over to over in North America, and it could start spreading just about anywhere. And this is when vaccines really come into play again. Not only that, since it's flu season again, so influenza is affecting people. And parents say they wanted to protect their little ones, but they do not want to protect their little ones, so why were they even demanding these? They asked for it, so they got it, but they refused to get their little ones vaccinated. And vaccines are one of the key components which tips that actually can help flatten the curve of coronavirus and its variants and subvariants. So why would they even bother trying to ask for a vaccine that they did not decide to utilize? And especially this season, things are really going pretty bad, with more people sneezing, coughing, which also vaccine, masking, physical distancing, limiting gatherings, they all worked. And also masking does protect against getting affected by other infectious diseases, and influenza is one of them. Which health experts are also recommending people utilize the bivalent vaccines, which they are good enough as the regular vaccine shots. So you can go get vaccinated at a vaccination center, register through the vaccine registration sites or the toll-free number at your local pharmacies, or you can check with your local health units. And this was a great opportunity for the little ones to actually get their first vaccine shots, because they also need to their protection as well. And there have been some little ones under the age of 5, and even the toddlers like 6 months or older, and they ended up in the hospital because of they were affected by coronavirus or any of the variants or the subvariants. And that was when, especially when vaccines for Tots was not approved, and doctors and nurses couldn't do a thing. So those little ones, they had to have their antibodies spread and fight off the virus, and that was a very complicated time. And although hospitals they can use them, so nurses can vaccinate these little ones, but the parents, they really need to check in with actual reliable people in the health field who actually do know that the positivity of vaccines, and not people who are misleading others through social media, or physicians who are also spreading misinformation about vaccines. And there are still physicians out there who do spread misinformation, and yet they still have their physician license, which they need to lose their license because they did not deserve to be in the health field. So we just need to await Pfizer Incorporated on their release of their vaccines for Tots. So continue to follow coronavirus safety rules and regulations. Be over any changes in reports. Don't listen to anyone who spreads misinformation or doesn't really care about other people's health, including Kieran Moore, Doug Ford, Sylvia Jones, and Stephen Leslie, after bad decision that affects Ontario. And Dr. Dina Henshaw over in Alberta. As they do not care about the safety of citizens in their provinces. And improvement of new ventilators, especially in educational settings like schools and daycare centers, need to be put in. And Stephen Leslie did not promise that, and he should. Stay safe. Wave 8 of coronavirus is affecting us. which some people are being affected right now. It hasn't come to everybody. It's something you should always be aware of and never let your guard down.